But we're going to begin with news tonight on this new variant spreading quickly in the U.S. In fact, tonight, the CDC now saying Omicron could double about every 2 to 3 days. That's what they're seeing elsewhere. Right now, already in at least 34 states. Here in New York, the Omicron variant now accounting for 13% of cases here and in neighboring New Jersey. Dr. Anthony Fauci saying today it will for sure become the dominant strain here in the U.S., surpassing the Delta variant. And look at the map tonight. Cases of the Omicron variant now discovered, as I mentioned, in at least 34 states and Washington, D.C. Tonight, we have learned the new variant forcing Cornell University in upstate New York to issue a level red alert, moving final exams online because of a suspected spread on campus. All of this as we deal with the Delta variant as well and this surge. Amid the holidays and the colder weather already here, people indoors, of course. Cases up 48% in just the last month. Hospital admissions up 42%. Tonight here we have news on the vaccines, how they're doing against this new variant, and also news on that promising treatment from Pfizer, a new COVID pill that the company says the new data shows its new pill cutting the risk of hospitalizations or death by nearly 90% if given within 3 days of getting symptoms, and that it works against this Omicron variant. Of course, the question tonight, how soon before it's approved? ABC's Stephanie Ramos leading us off tonight from New Jersey.
Tonight, health officials are warning the highly transmissible Omicron variant, already detected in at least 34 states, is now on track to take over the Delta variant.
It is going to be dominant in the United States, given its doubling time.
Omicron is now estimated to make up about 3% of cases nationwide and 13% of cases in New York and New Jersey.
What we're seeing in some of these other countries is doubling times of about every 2 days or so. So really rapid increase in the amount of Omicron that's out there.
In upstate New York, Cornell University today moving final exams online after finding suspected Omicron among many of the 600 COVID cases detected in the last week. Freshman Casey Winslow packing up and heading home.
It's really scary to know that I could possibly get COVID and might have to miss Christmas with my family.
Hospitalizations in New York State spiking 70% since Thanksgiving.
Cases are escalating, hospitalizations are escalating, and the number of people vaccinated is not where it should be.
The Delta variant already driving a nationwide surge, and officials fear teams on the front lines will be soon pushed to their breaking point.
We're exhausted by the knowledge that we are the duct tape that is preventing a complete collapse of the healthcare system.
Health officials stress the booster shots offer the best protection against Delta and Omicron. The first real-world study of Omicron in South Africa showed that 2 doses of the Pfizer vaccine are just 33% effective against infection, but 70% effective against severe illness. And hospitalizations linked to Omicron in South Africa were 29% lower compared to Delta.
The disease seems to be less severe, whether it's inherently less pathogenic as a virus or whether there's more protection in the community. We're just going to have to see when it comes in the United States.
And tonight, the most promising news yet on Pfizer's antiviral weapon to treat COVID. New company data showed the pills, when taken within 3 days of diagnosis, can cut the risk of hospitalization or death by 89% for unvaccinated high-risk patients.
We have a surge. We potentially have breakthrough cases as a result of the emerging Omicron variant. The ability to have a pill as a second line of defense is so critical right now.
Pfizer says its 5-day course of pills, which can be taken at home, could get authorization by the end of the year. Another antiviral pill from Merck is also under FDA review. Both companies believe the pills will likely work against the Omicron variant. Just a year ago today, the country celebrating the first vaccine shot. But tonight, a moment of silence on Capitol Hill to mark another staggering milestone. 800,000 lives lost, 500,000 since those first shots.
Just an incredible toll. Stephanie with us tonight. We know there was a CDC meeting today, health officials sort of gaming out what the Omicron variant could do in the coming weeks right here in the U.S. And I know that what concerns them most, even if it's less severe than Delta, is the fact that it's more transmissible than Delta, faster spreading, more cases, and that almost always means eventually more hospitalizations.
Right, David, and there's already concern about the strain on hospitals. You heard from that doctor there saying they feel like the duct tape preventing the collapse of the healthcare system. And tonight, we're hearing from Moderna's chief medical officer saying that it is possible, given the rise in infections, that the potential is there for both strains to infect the same person at the same time and swap genes, giving rise to a new variant. David?
That people could be dealing with Delta and Omicron at the same time. That's incredible and something we'll be watching. Stephanie, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.